Transmission and prevention of HIV. HIV is most commonly transmitted through vaginal sexual intercourse, anal sexual intercourse, and intravenous blood exposure by sharing needles with an infected individual. Although less common, HIV can also be transmitted through blood transfusions, from a mother to child before or during childbirth, and through breastfeeding. Even if the viral load in your blood is low or undetectable, the virus may still exist in body fluids such as semen, vaginal and rectal fluids, and breast milk, and thus HIV can still be spread between individuals. The most common way that HIV is transmitted is through unprotected vaginal intercourse. In women, HIV can enter the body through small tears in the lining of the vagina. The virus can also be absorbed through the lining of the vagina and cervix. In men, HIV can enter the body through the urethra, which is the opening at the tip of the penis, and through small cuts, abrasions, inner foreskin tissue, or open sores on the penis. HIV can also be spread through unprotected anal sexual intercourse. Data suggests that anal intercourse has the highest risk for transmission of any form of insertive sex. While the partner receiving semen is at a greater risk of becoming infected because HIV can enter through the thin lining of the rectum, the person who inserts his penis is also at risk because the virus can enter the body through the urethra or through small cuts, abrasions, foreskin tissue, particularly in uncircumcised patients, or open sores on the penis, such as caused by untreated syphilis or herpes infection. The rectal lining is believed to be more susceptible to HIV infection than the vaginal lining, partly due to its relative fragility and the abundance of cells targeted by HIV in that area. The most effective way to avoid HIV is by abstaining from sex. However, if you choose to have vaginal or anal sex, a latex condom can help to prevent the spread of HIV. A condom helps to prevent the exposure of an uninfected partner to HIV-infected semen and protects the male's penis and urethra from HIV-infected vaginal or rectal fluid, blood, or other body fluids. Condoms can also prevent other sexual transmitted diseases and pregnancy when used properly. You can also help to prevent HIV by treating your other STDs, especially those that cause open sores, such as chancroid and syphilis, because HIV can enter the body through these open sores. In addition, antiretroviral therapy, also known as ART, can reduce the risk of HIV transmission between partners by reducing the amount of HIV in the infected partner's body. Early initiation of antiretroviral therapy for an HIV-positive person is important, as it greatly lowers the risk of sexual transmission of HIV. Receiving treatment for HIV infection decreases the amount of HIV in the body and in sexual secretions from the body. When ART is taken regularly, it has also been shown to decrease risk of HIV infection by as much as 96% compared to safe sex alone. Microbicides, which are gels or creams that can be applied inside the vagina or rectum, can also theoretically help to prevent against HIV by lubricating and reducing the chance of microtears in the lining, creating a physical barrier against HIV and preventing viral replication. At present, there are no HIV microbicides available, though numerous formulations are under study. Post-exposure prophylaxis, also known as PEP, may prevent the replication and spread of HIV. PEP involves taking anti-HIV drugs to reduce the chance of becoming HIV positive after exposure. To be effective, PEP must begin within 72 hours after exposure to HIV, before the virus begins to rapidly replicate. However, PEP is not 100% effective and does not guarantee that someone exposed to HIV will not become infected. Pre-exposure prophylaxis, which is also known as PrEP, may also help to prevent HIV transmission. A form of PrEP that is a combination of two antiretroviral drugs and which is available as a once-daily pill has been approved in the U.S. In a large study of over 3,300 individuals, the PrEP resulted in a 44% reduction in the incidence of HIV in men who have sex with men and transgender women who have sex with men. However, PrEP should only be used in combination with other HIV prevention strategies, such as condom use, and it is still unknown whether this prevention strategy is effective in heterosexual couples. Further data suggests that if the PrEP pill is taken faithfully on a daily basis with no missed doses, the effectiveness increases further. In addition to vaginal and anal intercourse, HIV can also be spread through contact with blood. One way this can happen is during blood transfusions. However, screening for HIV in blood products now essentially eliminates any risk of transmission. Sharing contaminated needles, especially in intravenous drug users, can also spread HIV. At the start of every IV injection, a small amount of blood enters the needle and syringe. If a person who previously used the needle was infected with HIV, uninfected individuals using the same needle and syringe have a high risk of HIV infection. HIV can also be spread by using contaminated syringes to prepare drugs, reusing water, reusing bottle caps, spoons, or other containers used to dissolve drugs in water and to heat drug solutions, or using small pieces of cotton or cigarette filters known as cottons to filter out particles that could block the needle. To prevent the transmission of HIV through infected syringes, needles, and other drug equipment, people who use injected drugs should only use clean and sterile needles obtained from reputable sources, such as pharmacies or needle exchange programs.